1 in 10 complex hip fracture surgery patients end up back in the operating theatre due to orthopaedic screws working loose from the bone. This occurs because the nature of existing screws limit how well they can be anchored. Curtin University biomedical engineers, in collaboration with orthopaedic surgeons, have created the REX screw that addresses many of the deficiencies of current designs. Its retractable spreading arm mechanism means it can be attached more strongly, increasing the effective range of where the screw can be placed in the bone. This improves rehabilitation and mobility and reduces the likelihood of the patient losing their independence. A further advantage of this design is that if it becomes necessary to remove the screw, it can be done with minimal risk of damaging the bone or increased risk to the patient. Although the REX screw is particularly suited to hip fractures in patients with poor bone quality, the design can be adapted to other areas of the body, such as the spine and shoulder. The REX screw has surgical community validation and is licensed to a medical device startup with plans to develop a range of products for major markets. Globally, 1.6 million hip surgeries are carried out each year, costing around $20,000 each. This innovation not only has the potential to positively impact on the cost of healthcare, but more importantly, on the quality of life of the patients.